I'm Gary Bebow, CEO of WRHS Health System, and this is my June CEO Connection. I'm really pleased today to have with me Terry Bunch, our Chief Nursing Officer, who just started with us in the beginning of April. Terry's a welcome addition to us. She comes with great background and experience, and gosh, I'm really excited about the things that she's seen through clear glasses or different ways than we've seen it in the past, and I'm really excited about some of the changes that I'm sure will come about that will improve our operations. So Terry, why don't you tell us a little bit about yourself and what brought you to Batesville, and give us a little bit about yourself.
Thank you for this opportunity to come and speak and meet with you. And I've been a nurse since about 1977, so we won't count how many years exactly that is, but it's been a while, and I've had the opportunity to work both in the urban and the rural communities for big organizations and small. And my heart is in the rural community. I think that's one of the things that really excited me about this place, is because it was rural. I think the opportunity to take care of your family, both relationships, but people that you know in the community. You're going to run into them at church. You're going to run into them probably at the store, like I did my first weekend here.
That's true.
And so I think that's a special place for me in nursing, is in the rural community. And I think you need to have a heart of servitude with an attitude of humility. I think healthcare is very challenging and can be a very tough job, and so people get into it for wanting to help people. If you're getting into it for any other reason, you've probably chosen the wrong profession. So my heart's there, and I'm excited to be here. I do think there's opportunities for change here with healthcare and constant motion. You never quit growing, and you never quit having opportunities for change. And so I'm excited about what I can bring to the table and share, and that we collaborate and come to those decisions together.
We've really got a great group of managers. Don't you think that?
Yes.
I think we all get along well together and have fun, and I think we really do good work.
And I'm very impressed with the loyalty and dedication the employees have to the success of this organization. I see that in their actions, and so that's exciting.
That is exciting.
They're walking the talk.
Yeah. Tell me a little bit about your family.
So I married my childhood sweetheart.
Oh,
we're still married. Yeah. I have 3 children. I have 2 grandchildren. They're coming up this weekend, as a matter of fact. They have a 4-day weekend. They're out of school, and so I'm going to bring them around Batesville. They're looking forward to that complex opening. I'm going to get them a membership there so we can participate in the community. And so I'm closing on 5 acres of land this next week, so I'm getting grounded.
Getting settled into Batesville.
Getting settled into Batesville.
Tell me any thoughts you have in terms of areas where you think you'll spend most of your time, at least initially, in the improvement process?
So I'm spending time learning the managers,
sure.
and learning, what the current processes are here, and just trying to evaluate those and see where can we make change so that we have better patient outcomes, but that we're also good stewards of our finances.
Yeah.
And I think we have to have both.
It'll take a little while. I mean, gosh, I know you'll have some first impressions, and some of those will be solidified the more you get to know, and some of them may be revisions. So so we really look forward to having you here.
Well, I'm
I
excited to be here.
Appreciate you choosing to come work with us, and
It's
look
an
forward to a
honor.
lot of great things in the future. So. And thanks for coming spend the time with me today.
Thank you.
Employees of the month that I want to recognize today are from Stone County Medical Center. We have Angie Treat, who's an RN in the emergency department. Angie's been with us 13 years, and she's being recognized for providing great patient care and patient satisfaction. At Waver Medical Center, Tamara Stubbs, an RN on our cardiac rehab, has been selected. She's been with us some 25 years and being recognized for demonstrating the standard of behavior demeanor. And so, gosh, I've known Tamara for, I guess, almost all those 25 years, and it's really great that she gets recognized as Employee of the Month. So if you see both Angie and Tamara, be sure to congratulate them and recognize their achievement. Starting on May 31st, we'll be doing our semi-annual employee forums. They'll run starting May 31st up to the next week, and the schedule has been put out of the times and who the presenters will be for each of the forums. I want to encourage all employees to come and get an update on how we're doing in the organization in accordance with our pillars, and just some other updates that I think will be of importance to you. So if you haven't signed up yet to come to the employee forums, be sure to do so in the next week or so, because I think they'll be really a benefit to you. It's one of my major ways of communicating how the hospital is doing to employees, and I also get the benefit of your feedback and interaction. So I'll see you at the employee forums. We got some changes in services that we're about to embark. Stone County Medical Center will soon open up a cardiac rehabilitation service up there. I think that it'll be very well received, and a lot of great planning has been going in to assure its success. So cardiac rehab at Stone County Medical Center. In terms of our internal medicine residency program, it will begin July 1st. However, the residents will be on campus the week before that. And during that week, we'll introduce them to Batesville and the White River Medical Center, and we'll have a matriculation ceremony on Friday, June 30th at 10 o'clock. I hope if you're available, you'll come and participate in the ceremony and welcome these new doctors into our community for their training. For the last 23 years, we've had a golf classic goes to the benefit of the White River Health System Foundation. This year it'll be on June 17th at the course at Eagle Mountain. Already we've had a great amount of interest in it, a lot of sponsorships, a lot of participants, and as usual we need all the volunteers we can get that day to make it a success. So if anyone is interested in coming out and being with us that day to assure the success of the foundation, please contact our foundation office and let them know of your availability. Now, the Friday night before the Golf Classic, there will be a pink dinner at the home of Robert and Beth Christian. The cost of participating at the pink dinner is $75 per ticket, but it'll be a tremendous event, well worth the money. Again, proceeds going to the White River Health System Foundation. If you're interested in coming to the pink dinner, please contact Tiffany Cox at 262-1834 and acquire your ticket. It'll be a great event that night. This concludes my June CEO Connection. As usual, if you have any suggestions on how I can improve it and make it more meaningful to you in the future, please let us know. So have a great rest of the month.